a pandemic here in Columbus. And no, I'm not talking about COVID-19. I'm talking about homelessness. Now, COVID-19 might have something to do with it, however. Here in just Columbus, just Muskogee County, we find that 276 individuals find themselves without a bed each night. That is over 10 people per 10K of population. Now, that is not a terribly high number compared to the rest of the US. It's about fairly average, actually. However, in terms of Georgia, it's one of the 4 biggest numbers that we have. Now, it is the duty of the shelters and the other community-based programs to provide care for these individuals and to reach out to them and keep in contact with them. However, due to COVID-19, there have been some issues with that. Some shelters have had to close their doors due to not having the resources to maintain proper social distancing procedures and still providing care to these individuals. Now, these individuals not being taken care of in shelters brings us to a lot of other problems. It brings up problems with safety. It brings up problems with not being able to follow the CDC guidelines. And it brings up a lot of problems. It shows a lot of problems in our community. Now, does the homeless rate in Columbus directly impact its crime rate? No. To put it simply, there is no study that has shown a definitive link between a rise in homeless population and a rise in crime over the last 20 years. That's an interesting statistic because a lot of people, when they think a homeless person, they almost immediately think a criminal, which is a little offensive and a little messed up. These homeless shelters are trying to provide for these people who, a lot of whom are either mentally or physically ill. And that is why they are homeless, not because they are dangerous criminals. However, safety doesn't just mean safe from violent crimes. Safety also means, especially in times of pandemic, it means safety from everything that they may be exposed to from not having a safe home every night. Now, people living in unsheltered homelessness may be unable to afford supplies needed to keep both themselves and their communities safe. They may not be able to afford to buy new masks. They may not be able to afford hand sanitizer. They may not be able to get these basic things that we are all using in order to keep ourselves free from this pandemic. Their mental or medical conditions also may prevent them from wearing masks and may have them transmit this disease more easily than others. And this is where the shelters need to come in and keep in contact with those individuals, make sure they have what they need, make sure that they understand what is going on. Now, the CDC already has many guidelines in place regarding homelessness. Some of the main guideline points are that the shelters and the community-based programs should provide hygiene supplies to those who cannot afford them, such as hand soaps, hand sanitizers, masks, just protective and sanitary equipment. Shelters should keep in contact with those they aren't housing, not just the ones they are. That those in homeless situations should avoid mass gatherings that don't involve social distancing. So this comes into play where we talk about soup kitchens and other things of that nature, where there are a lot of people going into these. There's a lot of people going into these places, but there's not a lot of social distancing until now. That is one reason that a lot of these shelters have had to close their doors. They're not able to maintain that social distancing and still provide to the same amount of people that they were before. There are some basic ones like, wear masks whenever possible, and if they are able to. And the shelters are supposed to create overflow sites for those who are infected, such as the hospitals are already reaching capacity. Where are they going to go? They can't just go out back onto the streets, because then they run the risk of infecting other people. It is the shelter's duty and the community's duty to provide for these shelters to get more spaces, more beds, more areas where these individuals can sleep peacefully. And they also are supposed to give them equal opportunity to test for the virus. The same opportunities that we have to test for free, they also should be receiving. However, in a lot of cases, they are not, due to, once again, lack of funding. Now, according to a Channel 9 news story, the House of Mercy in Columbus, it's on 3rd Street, just right over there, it traditionally serves meals to the homeless and anyone else who needs a meal. They just come up, get a free meal on, I think around lunchtime is what I read. But the dozens who normally eat there were turned away Friday morning. Now this report is from earlier this month, and it talks about how they closed their doors. They were only providing for those already in the shelter. They weren't accepting new people because they didn't have the space. They didn't have the areas to control the people in it to create the social distancing atmosphere that the CDC recommends. And so they had to close their doors on these hungry people. Now, Willie Wilson, a House of Mercy visitor, said he doesn't even know where his next meal is going to come from. Now, we don't know whether Willie was homeless or if he was just someone receiving meals on behalf of the House of Mercy, but the community depends on services like these. But these services also depend on the community. So it's our duty as a community to provide everything we can, look for opportunities to volunteer, and ways to help out with these organizations.